is Jasenia. I'm a student nurse practitioner and I'm performing your assessment today. How are you?
I'm doing fine.
Can I get your name and date of birth?
Yes, Demetra Henderson, January 18th, 1960.
Are you in any pain today?
No, so far so good.
Okay, and today's date?
Yeah, today is November the 10th, 2025.
Okay, good. So Ms. Henderson presents her stated age. She's able to effectively communicate with me. She's alert and oriented person, place, time, and situation. She has good hygiene, good posture. She's dressed appropriately for the weather. So we're gonna go ahead and begin the physical assessment by palpating her scalp to look for any masses or any lumps and any infestation. And we'll do some hygiene first.
Okay. Okay.
Alright, so feeling for any masses, lumps, infestations. Alright, so there's no masses, no lumps felt, no infestations such as lice. Also, Ms. Henderson's skin is dry, warm, and intact. So now we're gonna go ahead and palpate her lymph nodes, looking for any swelling, masses, or lumps. So if you have any tenderness, just let me know.
Sure.
So we're gonna start with the preauricular, postauricular, occipital, post-cervical, superficial cervical, deep cervical, and subclavicular, tonsillar, submandibular, and submental. Did you have any tenderness?
No, I did not.
Okay, good. I didn't feel any lumps or masses, so that's good. So now we're gonna move on to test your cranial nerve 5 and cranial nerve 7. Cranial nerve 5 is your trigeminal nerve, and I was gonna ask you to bite down on your masseter muscles. So
Okay.
let's see how strong they are. All right, very good. I'm just gonna feel your temple. All right, I'm gonna open up your mouth. Don't let me. Very good. And you can relax for me. All right, I'm just gonna get your feel your pulses in your temple. Okay, very good. Pulses +2. So now we're gonna move on to cranial nerve number 7, which is the facial nerve.
Okay.
So I'm just gonna ask you to close your eyes, and I'm gonna take this Q-tip and I'm gonna touch you in certain places in your face, and you just let me know where I'm touching.
Okay. Cheek.
Okay.
Nose.
Very good.
Chin.
Mm-hmm.
Cheek.
Mm-hmm.
Forehead.
Yep, perfect. All right. Now, if you can smile for me.
Sure.
All right, frown. Puff your cheeks out. All right. Open and close your mouth. And then lift your eyebrows up. All right, very good. So cranial nerve 7 and 5 are intact. Now we're gonna move on to checking your eyes.
Okay.
So just looking at Ms. Henderson's eyes, her sclera is white. There's no discoloration such as redness or yellow. And then what's gonna just, can you look up for me?
Mhm.
All right, and then look down for me. Very good. Her conjunctiva is pink and moist as it should be. She has no eye discharge, no exudate, no drainage. Have you had any issues with your eyes?
No, so far I have not.
Okay, very good. So now we're gonna test cranial nerve number 2, which is the ocular nerve. So also prior to starting the video, we tested cranial nerve number 2 with the Snelling's chart. And Ms. Henderson's vision, it was 20/20 in the right, 20/20 in the left, and 20/20 in both eyes. But we are gonna check her peripheral vision. So if you can just look at me,
Sure.
and then when my fingers move, just let me know.
Okay. Moving. 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 Moving.
All right, very good. So that's cranial nerve number 2. Cranial nerve number 3 is the ocular motor, and I'm going to test that by dimming the lights to dilate the patient's eyes, and then I'm going to shine my pen light in the pupil to make sure they properly constrict. So if you just look straight ahead for me. All right, very good. 3. Next, we're gonna check cranial nerve number 4 and number 6. Number 4 is the trochlear, and number 6 is the abducent. And I'm just gonna ask you to continue looking at me and to follow my pen light with your eyes and not your head.
Okay.
All right. Very, very good. All right, so we're gonna move on to the nose. So looking at Miss Henderson's nose, her nose is midline, symmetric. There's no bumps, no bruises, no lesions. Have you had any drainage, any issues going on with your nose?
No.
Okay, no congestion.
No
Okay,
congestion.
very good. All right, so I'm just gonna start by palpating your sinuses,
Okay.
your maxillary sinuses right here. Right, and then your facial sinuses right here. Very good. And no tenderness.
No.
Okay, good. So now we're going to check inside of your nose.
Okay.
So I'm just gonna tilt your head back a little bit. All right. So bilaterally, her mucosa is pink. Her turbinates are they're not enlarged, and they look good. They're healthy.
Okay.
So now I'm gonna ask you to cover your nostril, take a deep breath. All right, and then cover your other nostril, take a deep breath. All right, very good. So now we're gonna check cranial nerve number 1, and that's the olfactory. And I'm just gonna hand you this container if you can smell it, let me know what's in it.
Coffee.
Very good. So cranial nerve number 1 is intact. So now we're gonna move on to Ms. Henderson's ears. So just observing the ears on the outside, they look good. They're midline, no lumps, bumps, bruises noted. So I am gonna take a peek in the inside by pulling the pen back. All right, very good. So tympanic membrane is pearly gray. Pulling it in the back and looking in. All right, same with this ear. Tympanic membrane is pearly gray. There's no drainage, no blood. Everything looks good and clear in there.
Okay.
All right, so now we're gonna do 3 hearing tests: a whisper test, a Ryan's test, and a Weber's test.
Okay.
We're gonna start with the whisper test. So I'm going to cover one ear,
Okay.
whisper something, and then you just let me know what you heard.
Okay. Apple, banana. Hot, cold.
All right, very good. So now we're gonna move on to the Weber's test. So I'm gonna strike the tuning fork, and then I'm going to give you 2 options: option 1, option 2, and you let me know which option you heard the best.
Okay.
Option 1, option 2.
1.
Option 1, option 2.
Option 1.
Okay, perfect. So bilaterally, Ms. Henderson said option 1 was the better option. So that means air conduction was better than bone conduction, which is to be expected in a healthy patient. All right, so next we're gonna do the Weber's test, and I'm gonna strike the tuning fork again, put it on your forehead, and let me know if you can hear it from both ears.
Okay. Yes.
Okay, very good. So that was cranial nerve number 8, the acoustic nerve that we just tested. So now we're gonna go into Ms. Henderson's mouth. Looking at her lips, they're not dry. She appears very well hydrated. No cracking, no lesions, no bumps noted. So now we're just gonna take a look inside and check some cranial nerves in there. So can you just open up for me? All right. So looking at Ms. Henderson's gums, her gums are intact. There's no bleeding, no cuts, no bumps noted. Her tonsils are intact and there are no redness. So now we're gonna check your cranial nerve number 10, which is the vagus nerve. So I'm just gonna ask you to say ah for me.
Ah.
Okay, her uvula is midline. It doesn't favor one side, so that's good. So then now I'm just gonna check your glossopharyngeal nerve. It's your gag reflex. I'm just gonna gag a little bit. I'm sorry. Okay, very good. Miss Henderson has a good gag reflex. So cranial nerve number 9 is intact. So now I'm just gonna ask you to check, so we can check cranial nerve number 12. I'm just gonna ask you to stick your tongue out and move it back and forth for me. Yep, very good. All right, so next we're gonna move on to your neck. So just looking at Miss Henderson's neck, again, no lumps, bumps, bruises. Her skin is warm and dry. Her trachea is midline. We already palpated her lymph nodes and that checked out fine. So now I'm just gonna stand behind you. I'm gonna ask you to put your head down and swallow for me. All right, very good. That was me checking Ms. Henderson's thyroid and it was not palpable. So next we're just gonna do some range of motion. So if you can just go front, back, side to side. All right, give me some circles. Very good. So good neck range of motion. Now we're gonna check cranial nerve number 11, which is an accessory nerve. So I'm just gonna ask you to shrug your shoulders against resistance. A little bit higher for me. All right, very good, very good. All right, so that cranial nerve is intact. Now just do a little bit of range of motion, your shoulders, if you can just go up, and then to the back, to the side. Swing your arms around for me, really good. If you can just put your arms out. All right, can you put your finger out? All right, and then can you do that for me? All right, very good. All right, so that checks out fine. So now we're gonna move on to posterior. And so now I'm just gonna inspect your back. So in a real clinical setting, I would have my patient's back exposed. So I'm just gonna observe it, look for any lumps, bruises, masses, and then I'm going to just touch her spine. Her skin is intact, everything looks good. All right, so I'm just gonna place my hand on your back, and if you can say 99 for me.
Sure, 99, 99, 99, 99.
One more time.
99.
All right, take a deep breath for me. All right, perfect. And I'm just gonna percuss. Sorry.
That's okay.
All right. Every time my diaphragm touches your back, if you can just take a deep breath for me in through your nose and out through your mouth.
Okay.
All right, go ahead. Very good. All right, no adventitious sounds noted. Everything sounds good. So we're gonna do the same in the front. Let's see, I'm just gonna check your chest out. Everything looks good. Like I said, your skin is warm, dry, and intact. So if you can just go ahead and 99 for me.
99, 99, 99, 99.
All right, take a deep breath for me. Let it out. All right, and I'm just gonna listen to you. And same thing, deep breath every time my stuff touches you.
Okay.
very good. Clear breath sounds noted throughout. No adventitious sounds noted. All right, so next we're gonna move on to cardiac.
Okay.
So I want to inspect Ms. Henderson's pericardium, and I'm going to look for any visible lift, heaves, or thrills. So I'm checking. I don't see anything, so I'm just going to go ahead and palpate the 5 cardiac markers, feeling for any lifts, heaves, or thrills. All right, nothing felt, nothing observed. So I'm gonna go ahead and also take your 5 cardiac, starting with your aorta.
Okay.
Pulmonic, Erb's point, tricuspid, and mitral. And listen to your apical pulse for 1 minute.
Okay.
All right, very good. Everything sounds good. And now I'm gonna use the bell and listen to those same cardiac.
Mhm.
All right. So now I'm gonna ask you to go ahead and lay back for me.
Okay.
And we're just gonna do a reassessment of your lung fields and your cardiac markers in another position. So I'm just gonna start with deep breath from in and out. All right. So now we're just gonna do the cardiac assessment again, and then lung sounds were clear, no adventitious breaths noted in her lung fields. So like the first time, I'm just gonna just observe your pericardium for any visible lift, heaves, or thrills in this position.
Okay.
Right, there's no notice. I'm just gonna palpate. Sorry,
Okay.
my hands are probably cold.
That's okay.
Erb's point. Tricuspid. everything sounds good.
Okay.
Just my bell. All right. Everything sounds good. No murmurs heard. That lab dub was noted. Oh, let me do one more last thing. If you can take a deep breath in and hold it for me. Okay, very good. Let it out. Another one. Very good. Since you're aorta.
Okay.
Okay, good. Now I'm just gonna check your pulses. Start with your brachial pulse. Alright, your radial pulse. Your popliteal pulses. Your posterior tibial pulses. And your dorsal pulses. Very good. All +2 pulses. You want to just look between your toes and check your capillary refill.
Okay.
Everything looks good there. Alright. Your skin is warm and dry. No swelling, no weeping noted. Skin is intact. Looks good. Oh, actually, forget that. Alright, can you press down on the gas pedal?
Yes.
Alright, and then push up against my feet, my hands. Alright, very good. Okay. So now we're gonna go ahead and do your abdomen.
Okay.
So I'm gonna start by just looking at it in a real clinical setting. I would have my patient's abdomen exposed. Just looking for symmetry, any surgical scars. And I'm gonna notice that my patient, her stomach is soft and round. And I do note a C-section scar from 38 years ago, but everything is intact. So now I'm just going to take a listen to your vowel sounds.
Okay.
All right, everything sounds good. Vowel sounds noted. So now I'm just gonna percuss. And right here, I'm hearing dullness because this is where my patient's liver is at. And right here, I'm hearing tympany, which is a good sign, which tells me that her spleen is not enlarged. So now I'm just gonna go and I'm gonna palpate. I'm gonna start with just light touches.
Okay.
And let me know if that's causing any discomfort.
Okay.
Any issue with constipation, diarrhea, or anything?
No.
How's your appetite?
Good.
Okay. All right, now I'm gonna palpate a little bit more deeper. Just
Okay.
let me know if it's any discomfort.
Okay.
I'm gonna palpate for the liver, right? No enlargement. Alright, now I'm gonna ask you to take a deep breath for me and hold it.
Okay.
Alright, and her spleen was palpated, no enlargement noted, so that's good. Alright, so that's your abdomen checks are fine. So now I'm going to, if you can take your palm out for me.
Sure.
Do you agree that this is sharp
Yes.
and this is dull?
Yes.
Sorry, dull.
Mhm.
Alright, if you can close your eyes, I'm just going to randomly touch you with these items
Okay.
in random places and let me know if you're feeling dull or sharp.
Okay. Short.
Okay,
Short.
very good.
Dull. Short. Short.
Good.
Short. Dull.
Alright, perfect. Alright, so if you like, you can go ahead and set up for
Okay.
me. And then we'll check some reflexes.
Okay.
Alright, so we're gonna start with the bicep, which is C5 to C6. So you can just relax right there. Alright, and I apologize in advance. Alright, and then we're gonna do the brachialis, the radial brachialis, which is also C5 and C6. Alright, and then we're gonna do the tricep, which is C7 to C8. Alright. Relax the bone. Alright. Okay.
Okay.
And then now we're gonna do the quadriceps, which is L2 to L4. Alright. And now we're gonna do the Achilles, which is L4, L5 to S2. Relax for me.
Okay.
Alright, and then now we're gonna do the last one, which is gonna be relax.
Okay.
L4 to S2. Very good. Alright, very good. Did it tickle?
Yeah.
Sorry.
That's okay.
Okay, so now we're gonna just do some little range of motion things. But before we do that, I'm gonna give you 3 words to remember: brown, dog, and nugget.
Okay.
And at the end of the assessment, I'm gonna ask you what those words were.
Okay.
All right.
Okay.
So if you can grab a hand. All right. Can you pull me towards you? All right. Very good. Now can you touch your thumb with all of your fingers?
Okay.
All right. Underline. All right. Very good. Can you stand up for me? All right. Actually, you can do one thing. Can you lay down for me? I'm sorry. I forgot to do a little bit of range of
That's
motion.
okay. That's fine. Okay.
You can just lay down.
Okay.
Yeah, sorry about that.
That's okay.
All right, can you just put your left leg in the air just a little bit? All right, good. And then kind of swing it out. Very good. And then now your right leg. Right, swing it out a little bit. Okay, very good. Alright, yeah, you can start for me, I'm sorry.
That's quite all right. That's okay.
Alright, and then if you can stand up for me.
Okay.
And then do a little hip flexion, left to right, front, back. Alright, and then can you walk towards me?
Sure.
Alright, and then can you walk towards the table, heel to toe,
Heel to toe. Mhm.
heel in front of your toe.
Okay. Right. Like that. Heel. Okay.
Yep, that's fine, yeah.
Okay.
Yeah, alright, so are you able to tell me what those 3 words were?
Yes. Brown dog nugget.
Yes, sounds good. Alright, thank you.